Hello, am I audible? Hello,
Hello, ma'am.
Yes, ma'am, you're audible.
I'm audible, right?
Yes,
Okay.
yes, you're audible.
Is it clear or do I need to wear headphone or anything?
I think now it's okay, but let's see, ma'am, because sometimes the range problem is there. So now it's okay.
Okay, fine.
You can check the screen now, no problem. And good evening.
Yeah, good evening. Yeah.
Yes, yes,
Can you see the screen?
yes, yes.
I've shared my PPT. Is it visible?
Yes, ma'am, it's visible.
It's visible, right?
Yeah.
Is it fine now?
Yes, yes. You can start sharing once. Uh,
Yeah. I'm just seeing it once, just checking it out with you guys. Is it fine, now?
yes,
This
yes.
is fine, right?
Yeah.
Okay.
Hello, ma'am.
Yes.
Should we start? Should we start?
Yeah. Please start.
Okay. So, a very good evening to all. And this is Excel free webinar season 4. So, dear doctors, PG students, internee and UG students as well, all the health workers, along with the lover of homeopathy. Myself, Anupriya from GT Memorial Homeopathy Medical College and Hospital. I welcome all to this clinical series. Before starting, I just want to give a little introduction about IHMA. IHMA, that is Indian Homeopathy Medical Association, is well known not only for its webinar, but for its subsidiary division, which was equally contributed for its growth of homeopathy across the nation as well as for the world. The subsidiary of IHMA mainly are the Indian Homeopathy Research Center, IHRC. It has played a pivot role with its recommendations in the major decision of the state health ministry regarding the public health. Even the COVID era has been the IHMA research wing making the marks by bringing up the health concerns of the public and recommended for the inclusion of homeopathic treatment for mitigation and treatment of COVID. IHRC contributed the second online research workshop during this pandemic, which was very highly beneficial for the participants. Next, the Homeopathy Medical Panorama, an official journal of IHMA, contributed the training for upgraded the clinician for the knowledge of IHMA members. Third, the IHMA School of Homeopathy has succeeded in imparting training to the budding homeopaths to clear the challenging entrance exam and the state and national exam level, including PG entrance exam. Now, moving forward, before starting the session, never forget to salute our master, Dr. Samuel Hahnemann, who made a reason to gather here together by discovering the most holistic science, that is homeopathy. Thank you so much, Master. Now, I would like to request Dr. Ketana for the faculty introduction. Welcome, Doctor.
Thank you, Dr. Anupriya. I'm Kirtana. I'm doing my PG in Sharda Krishna Homeopathy Medical College. And once again, good evening all. I extend a warm welcome to all. And I find immense pleasure in introducing our Honorable Chief Guest, Arpita Chatterjee. And good evening, Dr. Arpita Chatterjee. And her qualification is BHMS and MD Organon, CAH, CCP, MHA, and currently pursuing PhD in Organon of Medicine from Parallel University, Associated Professor and HOD, Department of Pathology, Parallel Institute of Homeopathy and Research, Baradora, guest lecturer for Community Psychology at Department of Psychology, Maharaja Sajiro, University, Baradora, founder of World Healing Society Foundation, and she runs private clinic of homeopathy at Baradora Healing Center. Awards: Women Achievers Award 2021 by Parallel University, Best Teacher Award 2021 by Academic Review Committee 2021, Global Icon Award for Social Work 2021, International Inspirational Women Award 2021 for being the young social activist and homeopath, Women Icon of the Year 2021 for being young social entrepreneur, academician, and homeopath, being Women 2020 Baradora Award winner, Chhatrapati Shivaji Heroes of Baradora Flex and Award, Pride of Baroda Award from HR Professional Society of Baroda, awarded Certificate of Appreciation for being an active COVID-19 warrior by Homeopathic Chikitsa Vikas Mahasangh, Rajasthan, guest speaker at Homeopathic Medical College, Navsari on World Homeopathy Day in the year 2017, article on the role of homeopathy and diabetes in the Journal of the Practitioner, number 2019. And I welcome you, ma'am.
Thank you so much for the introduction. A warm good evening to all of you, and special thanks to IHMA Kerala for inviting me for today's session. And driving directly into the session would be a little too fast to begin with, but as they say that everything should begin with a gratitude, so I sincerely express my heartfelt thanks to all the team of IHMA who have been so supportive and have always been a very good support in giving me the opportunity and the chance to present my sessions on different platforms. And for that, I'm especially thankful to Dr. Deepu, who takes this thing as very, I have seen him working very hard for this, and also the team of IHMA for trying to spread the knowledge of homeopathy to the masses, not only to the students and for the practitioner, for also to make sure that people around the globe come to know about homeopathy and how homeopathy could be of useful to everyone. And with this, so I would like to start my session, if it is fine with every one of you in the team. Shall I start the session?
Yes, ma'am, you can start.
Okay.
Share the screen.
Yeah, I'll share the screen. Is it visible?
Yes, yes, perfect.
All right. Is it visible? Okay. Fine. So today's topic is dermatitis and its homeopathic therapeutics. So this is a very interesting topic for any homeopath, because this is one subject in which we, this particular field, when it comes to skin, I have seen very good results with homeopathy, and this is one aspect in our practice where we can really show patients that without taking any type of ointments or without taking steroids, they can get cured with only these small pills of homeopathic medicines. And it gives magical results if we give prescription on constitutional remedies. And I have myself experienced this as excellent, because why I'll like to share one very simple thing on one of my personal experience, that I myself was suffering from a skin condition wherein and I was not a homeopath at that moment of time. I was studying in school, and homeopathy was a rescue, because it was not possible for any of the alternate conventional medicine to give me relief. I was on steroids and everything, but unfortunately, it was not giving me any results, and it had become chronic. It was for a long period of time. And as a student, I had experienced the magic of homeopathy, especially in skin diseases. Now, of course, I am a practitioner. It's a different matter. But when I was a student in school, I'd seen how it can give magical results. So with that, they say the capacity to learn is a gift, and the ability to learn is a skill, and the willingness to learn is the choice. So taking into consideration this aspect, I would like to tell you a warm thank you, especially for all of whom have decided to be with me today for this session. Thank you for showing this willingness and making a choice to be with me today for this learning session. All right, so starting with the skin, we'll start with basics of it. So the anatomy, we will try to understand the anatomy of it, then a little bit of the pathophysiology, and then we'll go into the types of skin diseases, or especially dermatitis, because we are focusing only on dermatitis. There's a lot of different classification, but we will only restrict ourselves to dermatitis. And later on, we will try to see the therapeutics, the medicines which we use in these conditions. So starting with the functional anatomy of skin. So skin is basically made up of two major layers. There are. First is the uppermost layer of the skin, which is known as the epidermis. And beneath that is the dermis, the deeper layer of the skin. And between these two layers, there is a membrane which separates them. And beneath the dermis layer, the upper layer is epidermis. Then we have the dermis, and this epidermis is again made up of two cells which are stratum corneum and stratum lucidum. And beneath them is that dermis layer. And the dermis layer is made up of this stratum granulosum, stratum spinosum, and stratum basilae. And between these two layers, there is always a membrane which separates them. And beneath the dermis layer, we find the subcutaneous tissue. So basically, if you see, the skin is divided into two layers, and beneath the second layer, we have the subcutaneous tissue. Now, understanding dermatosis. Now, this is one terminology which is being used in medicine. Now, what is dermatosis? It is a terminology which is used for any neoplastic skin disorder, meaning which is not cancerous. Any type of disorder of the skin which is not cancerous is considered into this terminology as dermatosis. Now, it includes anything which is on the surface of the body, like the skin, the nail, and the hair. So anything which is which has a disorder, whether it's skin, it's nail, or the hair, would be put into dermatosis. The one thing we need to make sure it is non-neoplastic, meaning it is not cancerous. Now, but it is different from the word dermatitis. When we talk about dermatitis, itis means inflammation. So when inflammation is involved, then it is not called as dermatosis, then it goes to into the category of dermatitis. So here today we would be trying to understand what is dermatitis. Now, what is dermatitis? As I already told you, itis means inflammation of the skin. So when there is inflammation of the skin, that is known as dermatitis. All right, so it is an inflammatory reaction. So we know in inflammation, what do we see? We see congestion, redness, loss of function, pain, edema. So these are the inflammatory things which you will see on any inflammatory condition. So when it comes to skin, we will see the same things. What we see in an inflammatory reaction, there would be this inflamed condition of the skin, where there will be congestion of the skin, edema, it would be painful, there would be loss of function, in the sense the skin will not be smooth or normal, and of course there would be a little difficulty in the day-to-day activity because of dermatitis. So this is what is termed as dermatitis. Now there's another word which we use in our medical science, and that is eczema. Now, eczema is basically used for the clinical terminology. It's a clinical terminology, and dermatitis is more of a pathological term. So when I talk about dermatitis, it becomes very easy for anyone to understand that this is a pathological condition where you see inflammation, right? But when we are talking about eczema, we are talking about a clinical, and both of them are synonymous. It is the same. It is not different. Just the same thing, but eczema is more of the clinical terminology, and dermatitis is more of a pathological terminology. All right. Now, what happens in dermatitis is that apart from the inflammatory reaction which we see, which is going on inside the body, so what will you see on the surface of the skin? The prominent features would be blisters. There would be oozing of some kind of fluid, crust formation because of the fluid which comes out, and also there would be scaling of the skin, which would lead to flakes off. So there will be flakes, you know. So these are the primary features which you will see in dermatitis. All right. So and one thing, this is an abnormal body's reaction. So it is not a normal reaction of a body to give such kind of inflammatory reaction. It's an abnormal sensitivity of the skin, because of which the body reacts in that way. All right. So therefore, it would be also characterized, when we talk about pathologically, it would be also characterized by spongiosis, which leads to vesicle formation. All right. So what do we understand by dermatitis? So dermatitis is basically a pathological terminology which is being used, and eczema is more of a clinical terminology which is being used. And it is the inflammation of the skin where there would be blisters, oozing, crust, or flakes off. And it's basically an abnormal response of the body's immune system. Now, these are the main features. So what do we see? The main features include erythema. So you can see here the redness of the skin. Then there's scaling of the skin. Then there's edema, vascularization, the small vesicles with fluid filled vesicles would be seen, and there could be also oozing. Doesn't mean that it has to be always like this. In some cases, there could be only erythema and scaling, no edema or a slight edema. In certain cases, there could be vascularization with oozing as well. So it depends on person to person, their constitutional factors, their other genetic susceptibility. There's many things which determine. So we'll talk about it later on when we go further. All right. So what is the natural onset and course of dermatitis? So what basically happens is that when a patient will come, there is a set of things which will happen to the patient. So initially what there would be there, then second what you will see, third, fourth. So what is seen? So basically the patient will first complain of having some redness, erythema, some slight redness, congestion. It's because of the congestion and because of the inflammatory congestion, you will be seeing this. Then it would be normally followed by papules with edema. And later on, these papules will be then filled with fluid. So they will turn into vesicles, or sometimes it is only vesicles, not papules, depends. There could be weeping, crusting, or pustules. So we are talking about a classical dermatitis. So in a classical eczema, what you will see, so there would be first redness followed by some papules which will turn into some vesicles. There will be some weeping, crusting, and pustules. There would be then scaling, itching, and everything. If it heals with medicines or without medicines, if it gets healed, then the skin will be totally fine without any scars. But if it continues, like if it is continuing, it is continuing for a longer period of time, because of the intense itch, the patient will keep on, scratching itself and doing all the, and that will give pleasure, and then there will be bleeding from the itching and everything. So what it will lead to is that there would be lichenification. So lichenification, so there is the dark, thickened skin. Thickening of the skin will happen because of continuous scratching and scaling, which will happen due to scratching. So because the patient is scratching continuously, that will lead to pigmentation, thickening of the skin, and that entire process is known as lichenification. Now, pathophysiology. Now, this is the very important aspect for any homeopath or any medical practitioner to understand, because when we understand the pathophysiology of a condition, especially in case of dermatitis, we can suggest the patient what the patient should be doing in order to make sure that the condition is under control and the aggravating factors could be avoided. Because in most of the time, what we see in dermatitis is that there is an allergen which is responsible. Not in every case, but most of the time there are certain allergens which are responsible for giving this hypersensitive reaction of the skin. So in those cases, it is required for a physician to first understand that what could be the reason of dermatitis. So pathophysiology to a certain extent is very much required for a physician to understand, and that a physician can only understand by taking thorough case taking, because thorough case taking will help the physician to understand ODP. Now, this is very important for any practitioner to understand the ODP of a disease condition. Now, what do we understand by ODP? It is the onset, duration, and phase of the disease. So how it started, it's very important for us. For how many years or days or months it is going on, so duration of it, whether it's slow or fast, that is very important for us to understand, because that gives us an idea that how the disease is progressing, what could be the prognosis of it, and the phase of the disease. Right now, whether it is in an acute phase, subacute phase, or a chronic phase, we need to understand that. Depending on that, there are many things which we as a physician have to suggest to the patient, because as a physician, we are also responsible for giving the patient the right advice. So that's why we are known as consultant, right? So if you see, this becomes a very important aspect for any homeopath to understand the pathophysiology of a condition, to give the right advice, to give the right medicine. And I'll also tell you that it is very much required for any physician to even understand what potency to give, what could be the susceptibility of the person. To even understand that, we need to understand the ODP. That's very important, right? So, and with today's advancement in medical science, whatever could be of help to us for understanding a case, which can help us to even understand miasm, the pathological condition, the phase, the onset, that should be taken into consideration. Now, when it comes to dermatitis, if you see in any medical book, they have not given any specific reason for the cause of skin diseases. So what you normally see in a medicine book is written as that the exact cause is not known. Yes, because we all know that a disease is not an exclusive thing. A disease or a disorder is an amalgamation of many factors working together. It's not only from one particular thing that will lead to a disease condition. No, it is never like that. There are many factors which together lead to a person getting diseased. So when it comes to dermatitis also, so what it has been seen that, first of all, if you see this this diagram, so there are, you can see multiple factors together leading to the disease condition. So what are the conditions which could be predisposing factors, or which could be the factors responsible for a person suffering from dermatitis? So first of all, it is seen that people who are genetically having some family background of diseases, especially if there are skin diseases. Apart from skin diseases, if there is a family history of asthma and a family history of hay fever, allergic rhinitis, it is seen that these people are more prone to have, or these families are more prone to have dermatitis in their generation. So family history, if you get a family history of asthma, then skin disorder, and this hay fever or respiratory disorders like allergic rhinitis and all, so it is a predisposing factor for a person to develop dermatitis. Then it is also seen that in certain eczematous condition or in dermatitis, that it is seen that people who gets too much stressed out or in certain emotional factors can also lead to the aggravation of the disease condition. So there are certain conditions which aggravates the dermatitis, and these are basically the stress level and the emotional factors are also correlated. Now, why it is, I'll let you know, because there is you can understand why it happens. Then there is I'll tell you about this. We'll go step by step. Then there is also a correlation seen between the nutritional excess or lack and sleep deprivation. Now, one thing we need to understand as physician, that whenever we take a case, especially when in homeopathic case taking, we always ask for these generals. Like we always ask for their sleep patterns, their appetite, their cravings, their desires. Now, many a times I've seen students they don't get interested in all these things. For them, it is like, why are we need to ask all these things, all these questions? Now, one thing I told you before the start of this, before coming to this slide, I told you that for any person to give advice and to give medicine, as a physician, we are not only restricted to giving medicine, we have a equal responsibility of telling the patient what they should include in their diet, what should be their regime, because health is about these factors. It is your mental, physical, social well-being, not one particular well-being. All right, just taking medicine and you're giving medicine to the patient and the patient going out of the clinic, that will not suffice. You as a doctor have a responsibility to make sure that we are the preserver of health. This is what Dr. Hahnemann said in aphorism number 4, that we are the preserver of health. So we have a responsibility of making sure that this person do not suffer from disease again and again. So that becomes a very big responsibility for every physician. Sleep deprivation is seen that because sleep is very much required for every individual. Sleep helps an individual because that is the time when the cells undergo healing. So the cell are rejuvenating at that moment of time. They are growing. They are clearing off certain things. So at that, if we compromise on our sleep pattern, it affects our system. It leads to increased oxygen-free radicals in our body, other toxic chemical mediators which are not cleared from our body, and that leads to you getting diseased. So this is one thing you need to understand as well. Nutritional excess or deficiency, you know that skin require, this is like if you see any channel on TV today, so they show this advertisements of different creams and everything, where they show that it contains vitamin A, it contains vitamin E, which makes your skin supple and beautiful. So you have seen that in advertisement also they talk about all these things. Of course, nutrition becomes a very important part for keeping the skin healthy. All right, so if it is less, if you're taking less of especially vitamins and minerals are very important. So if those are taken less, or if they are taken excess in quantity, can lead to disease condition. Allergens and irritants, now this is very commonly seen in today's time. So normally what we see is in your clinic, the patient who might be coming, they might come with certain type of allergic condition to certain detergents, soap, creams. So this is very commonly seen in today's era, because we are constantly, our body is in constant exposure to certain things around, especially chemicals and all those things. So these are the things which are the predisposing factor. Now these predisposing factors like genetic susceptibility, anxiety or emotional factors, some sleep deprivation, nutritional things, and some allergen in the environment. Now these things can lead to two types of reaction from a person. So one reaction is normal reaction. So if I am responding, which is known as the susceptibility of a patient. So if a person is responding to such stimuli, if the response of our body is normal, then the person will be healthy. In spite of the allergen and irritants around, you will be healthy. But if there is some abnormal sensitivity of the skin, somehow the sensitivity of the skin has become a little abnormal, meaning that your body is giving some type of abnormal reaction to the stimuli which is around. Okay, so that could lead to release of neuropeptides on the skin. Now this is now here I'm coming to the direct portion of what happens on the skin. If you talk about the entire body, different things happens, but now here, because we are concentrating on the pathophysiological aspect of only the skin, so here we will try to understand what happens to the skin, on the skin. If these factors like genetic factors, anxiety or emotional stress, the sleep, the nutritional, the allergens or the irritant, now this is reacting on the body, and your body is now responding to these stimuli. And it is an abnormal, when it gives an abnormal sensitivity, normal sensitivity, the body would be normally healthy, will try to ward off the bad effect of all these things. But if your body is giving an abnormal sensitivity, what will happen that on the skin because the skin has this enormous amount of neuropeptides which supply the skin. All right, so these neuropeptides are there on the skin. Now these are excited by all these factors which I told you, which are written already here. So once they are excited, they lead to the release of neuromediators like dopamine, histamine, all these other factors are released. Now, once they are released, like for example, in skin, histamine. So once the histamine are released because of the neuropeptides, this will lead to the allergic manifestation, congestion, and all those things. So this is how the inflammation would be seen. So this is the very short description of what happens and how your body reacts to these different stimuli abnormally, leading to the inflammation on the skin. Now, pathological classification of dermatitis is classified into genetic, because as I told you, dermatitis could be due to genetic factors, then there will be some inflammatory reaction. It could be due to infections like bacterial or viral infection could also lead to dermatitis. Granulomatous is a chronic type of inflammation which continues for a longer period of time. Then you have connective tissue. So if the inflammation is in the connective tissue, there are certain type of skin infection, inflammation where the only scaling is there. So it is scaling and bullous. So these are pathological classification, genetic inflammation, infection, granulomatous, connective tissue, bullous, and scaly. So these are the pathologically they are classified that way. So here we are trying to understand that why the dermatitis is it because of genetic reason, or is it because of some inflammatory condition like acute inflammation, or some kind of infection? Is it because of some granulomatous reaction of the body, where the body is giving some chronic abnormal reaction? And connect, or is the connect, which is the layer involved, which is the connective tissue is involved or not, whether there's scaling or bullous formation. So this is how it is classified according to the pathology. Now the classification according to etiological. So etiological classification, this is the most common way in which the dermatitis is being classified. And why? Because this helps you to understand whether it is an allergic condition or whether it is a condition arising from within the body because of some abnormality. And depending on that, we can advise the patient what to be done and what not to be done, meaning what they should avoid, what they should not avoid, what they should do, what they shouldn't do. So those are the things. So here we have the two main thing is exogenous, that is the factors are from outside. So there are some environmental factors which are causing the dermatitis. So this could be due to certain metals, or due to certain chemicals which are being used, like lotion, creams, or some jewelry, which are the imitation jewelry and all. And irritants, meaning the detergent, soap, this could be exogenous cause, or some pollution outside could be the reason for dermatitis. Endogenous, meaning here the causative factor is something from within. So from your body, there is some abnormal reaction which is being given in the form of either it could be, chronic or delayed type of hypersensitivity reaction, or very exaggerated type of reaction, like allergic reaction. So some type of abnormal reaction that could be as a result of some family history, or due to some genetic susceptibility. Because of that, there is some reaction which is coming from the body. There's no external agent to it. Of course, the external agents helps to aggravate the condition or increase the intensity of the disease, but basically it is from within. From something from within is abnormally reacting, and that is causing the dermatitis. And the last one is combined, where both the factors, the exogenous factors and the endogenous factors, both together are leading to the disease condition of the skin. Now there are, you can see certain names which it has been written. So exogenous, irritant contact dermatitis; endogenous is ectopic, seborrheic, Pompholyx, and Venous. Combined is nummular and discoid dermatitis. So we'll understand what is this now. All right. So before that, let's understand the morphological phase of dermatitis. So like we understood first here in the earlier slide that etiology, what is the cause of dermatitis? So there could be exogenous, endogenous, or a combined factor. Exogenous means something from outside, endogenous from inside, and the combined form. Then we have this morphological phase of dermatitis, where we see the phase, like in which phase the disease is. Is it an acute,
Mezereum. What is that?
There was some network issue. This is normally seen. So I hope everything is visible right now.
Yes, ma'am.
Okay, yeah. So here we will try to understand the morphological phases of dermatitis. So if you see, there are three phases. Acute. So when the patient will come, if there is erythema, meaning there's redness with edema, vascularization in small vesicles, oozing is there, and crusting is there with red and itching, intense itching and all. So sometimes there would be, and sometimes some patient might come with not that intense of itching, but there would be little itching there. So edema, vascularization, oozing, and crusting. If these things are seen, then it is acute. The second is subacute. So in subacute, what you will see, it would be erythematous, meaning there would be little redness, but the redness would be less compared to what you see in acute. Acute would be like reddish. Here it would be a little pinkish red or a little black, not pinkish, but a little purplish red. There would be hyperpigmentation. Plaques will be seen with scaling and crusting causing disc formation. So there will be disc formation seen on the skin. And in the last one, that is in the chronic, there would be lichenification, where there would be thickening of the skin with hyperpigmentation and prominent skin markings. Now, why that would be there? Because of the continuous itching and everything, and scaling and itching, what will happen? And with oozing and crust formation and all, so that leads to this thickening of the skin with hyperpigmentation. The skin becomes a little darker in color, and also there would be thick marking seen. So this is how you will identify what is acute, what is subacute, and what is chronic. So in chronic and subacute, there would be pigmentation seen, but in subacute, there would be more of scaling and disformation seen. But in chronic, there would be more of prominent skin marking and thickening of the skin, which would be seen. And in case of acute, you will be seeing only edema. Then there is small vesicles with some fluid filled, some crusting and oozing, and redness. So right now, what we will do after this is now I'll show you a figure. So you have to identify acute, subacute, and chronic. So you can write down in the chat box. So this would be more like a game, and also like learning this. It would be fun. So here, if you see, so if you can tell me what is the first thing. The first is this one. So what is this? This one. The second is the middle picture, and this is the last one, the third. So what do you feel? Which is the first one, the second one, and the third one? So just take 30 seconds and write down in the chat box, all of you. So with is it acute? Which is acute? Which is chronic? And which is subacute? So you can write down in the chat box, all of you, so that will help you to even understand the case better. A little learning and little playfulness. So you can just write down. So what is the first one? What is the second one? What is the third one? 30 seconds. I think the time is over by now. Or maybe 10 seconds more. Oh yeah, we have 10 seconds more. So what are the answers? Let's see. All right. So yeah, the answers, if you have seen, most of you are right, I think. So the first one is acute. All right. The first one is acute. The second one is subacute. And the last one is chronic. So you can see in the acute, there is swelling erythema. In subacute, there is punctate erythema and disformation of the skin. You can see here. And of course, the last one is there's thickening, dark skin, which prominent skin markings are there. And you can see the skin markings are due to, scratching on the last one. So that is lichenification. That is the chronic disorder. So this is how it helps us to identify the skin. So all of you are right. Thank you. Now the types of dermatitis or eczema. So types of dermatitis and eczema are atopic dermatitis, the contact dermatitis, seborrheic dermatitis, discoid, Pompholyx, and varicose dermatitis. So I have just enumerated 6. If you understand these 6, it would be better for your practice in the clinic. Also helps the patient also have a confidence on what the doctor is doing. Sometimes it's when we go to the doctor, we want to know what it is, what we are suffering from. So when a doctor can at least give a diagnosis, we feel confident about that doctor. So if you can understand these things, it helps to get your patient under confidence. So what are these? Atopic dermatitis, what is a contact dermatitis, what is seborrheic dermatitis, discoid dermatitis, Pompholyx, and varicose dermatitis. Very easy, you can understand it very well. Just a few things you have to remember, and when you see the skin condition, you will be definitely able to tell what dermatitis is. All right. So when it comes to the atopic dermatitis, the cause is, of course, as I told you, most of the skin disorder, the cause is not known, but it is seen that there is a genetic susceptibility that leads to epidermal dysfunction and abnormal immune response that leads to atopic dermatitis. So basically, it is seen that these people who are having atopic dermatitis, they have it in their family. So there is a family history. So that's why case taking is so important. So when you go for the case taking, you will come to know if there is a family history of having, I told you what all to look for. So what are the red flag signal? If the patient says that there is a family history of anyone suffering from skin disorder or hay fever, allergic rhinitis, or some kind of asthma. So this is something you should consider it into your practice. So it is mainly seen to be the exact cause is not known. What is causing the dermatitis, that we do not know, but here the family history is always seen. It's a chronic condition, and it normally what you see infantile eczema, which comes to the hospitals and many times in the pediatric departments. So what if there is eczema on the face and the flexure of the hands? This is mostly indicative of atopic dermatitis. Now, what could be the allergens? The allergen could be something from within, or it could be some allergic thing which can intensify, aggravate the condition. All right, there are certain allergens in the environment which could aggravate the condition, but they are not the basic reason for the dermatitis. And stress, nutrition, hygiene are certain things which increases if the hygiene is not good. If there's a lot of stress going around, nutrition is not that good, that could lead to an increase in the susceptibility to atopic dermatitis. So in atopic dermatitis, what you have to remember is that it's a chronic disorder. Then second thing you have to remember that there's a family susceptibility which would be seen. No exact allergen could be identified here, but the allergic factors could intensify the disease condition. And if an infantile eczema are basic, which on the face and the flexure are the ones which could be classified as atopic dermatitis. All right. Now, contact dermatitis is that because of some allergy resulting from allergens or irritant due to the exposure to allergies, some allergic factors. So what here we will see, like, see if you can see the diagram here, you can see that here the patient is might be wearing a ring or something which had led to this inflammatory condition. So these are certain things which you will observe in a person who is suffering from contact dermatitis. All right, so in contact dermatitis you will see this type of lining or something like that. Now contact dermatitis results from, as I told you, is basically seen due to when the patient comes in contact with certain thing. So the contact could be to certain metals like nickel, poison ivy, or certain other things like soap, detergent, cleaning products. Even sometimes it could be a cream, a moisturizer, powder, perfumes, anything which comes in contact with the skin becomes an allergen and causes this reaction. Now, this reaction is normally seen in 24 to 72 hours times. 24 to 72 hours. Between this period, the patient will develop the contact dermatitis. All right. Many a times I have seen patient who had come to me, especially female patient who had come to me with a condition where they had told me that I do not know, ma'am, from where I got this problem. On the skin, they will have somewhere in the hands or something, some inflammatory condition. So they would not be able to actually, connect the dots, like how it happened. Suddenly there was this itching and I started having this. So when, I remember in one of the cases it happened. So I asked the patient, like, what had she eaten the day before or something. She was unable to give any details about the things she had eaten, but one thing or something she had applied. But after a day, I mean, I have called after one day. So she had come to the clinic on the second day and she told me a very interesting thing. She said, ma'am, could it be because of the cream, the moisturizer which I am using? Because I started using the moisturizer 4 days back. And initially, the first day when I used, I had no reaction. Even second, third day also, I had no reaction. I'm still using it. So I do not know whether it is causing a problem or not. But yes, if you ask me in last 3 to 4 days what I have done, so this is something which I have included in my routine, which I was not doing earlier. So, many a times it is not that immediately you get a reaction. It could be also after a little delay of, say, 24 hours, 48 hours, sometimes at 36 hours, 72 hours, 3-4 days after. So this is known as delayed hypersensitivity reaction, the type 4 sensitivity. So in type 4 sensitivity, these people will show a reaction, but it would be a little delay. All right. And most of the time when it is an immediate reaction, it would be an urticarial rash that will appear, and the patient would be even able to tell the relation that from what happened. So in these cases, you need to definitely avoid the irritant, because once the irritant is removed, the symptoms will disappear. All right. Okay. Now, seborrheic dermatitis. Now, seborrheic dermatitis, it is closely related to the dandruff, also known as cradle caps in infants. So, the infants normally show these type of seborrheic dermatitis. It is endogenous type of eczema. Again, it is not exogenous, not something from outside. There is no allergen from outside which is causing it, but something, the reaction is from within, which is an abnormal reaction. And especially it affects the scalp and the face. So that's why and if it's seen in small children affecting the scalp, it is known as cradle cap in infants. All right. Now it has been observed because it is endogenous. So naturally, there is a genetic or a familial susceptibility to the condition, environmental, hormone, immune system. Plus, there is an yeast which is said to be causing or causing this inflammation. It has been associated, this yeast has been associated with seborrheic dermatitis. So the name of that yeast is Melasma furfur. So Melasma furfur is known to be involved with seborrheic dermatitis. And here, this is something you have to understand. Here it is written that excessive intake of, there's a mistake here, it's an excessive intake of vitamin A. So vitamin A, if there is an excessive intake of vitamin A, see, sometimes even in today's time, I've seen many a time patient comes, they are taking medicines, vitamins, there's indiscriminate use of vitamins. So this should not be the case. Even vitamins which are taken from outside, they are also chemicals. So even their intake should be also limited. It's just not like we can give somebody or we can recommend vitamins to someone for an infinite time. No. There is a limit to everything. So even if if a doctor has prescribed, if your patient is on vitamin, make sure, ask the patient for how long the vitamin they have been taking, because sometimes these are the main reason why the patient might be suffering from seborrheic dermatitis. So excessive vitamin A is the cause for seborrheic dermatitis. Then again, if there is lack of vitamins B6 and B2, then again there could be seborrheic dermatitis. Now, as you see, seborrheic dermatitis is related to the dandruff, it's closely related to dandruff. So that's why there is, if there is lack of vitamin B and vitamin 2, we all know that it also affects your hair, the growth of your hair and everything. So yes, exactly. So lack of vitamin B6 and B2 could cause seborrheic dermatitis. That could lead to hair loss. So in seborrheic dermatitis, because it's seen around the scalp and so on, so there could be damage to the hair follicles as well. All right. Okay. Now the other one is nummular or discoid. So nummular, this is a very interesting kind of eczema, because normally people when especially the physician can get confused with nummular eczema or discoid eczema with ringworms. Now, because both of them have a similar presentation, nummular or discoid eczema, they are, they're similar in appearance to ringworms, but there is a difference. There is a difference because in ringworm, here we need to understand ringworm is because of the infection is fungal in origin. There's fungus involved, and the people who are suffering from fungal infection or ringworm, they have redness, but circular redness, which are circular, but within the circle there would be, it would be pale. So around the circle the borders are more reddish and more prominent, whereas the internally there would be, it will be pale. On the other hand, when we talk about nummular eczema or discoid eczema, here the eczema, the spots of dermatitis would be like small points, small points like presentation. So that's why this word discoid or nummular has been used, because it means it is coin shaped. So there will be small circular pattern of eczematous condition seen on the skin. Mostly it could be acute or subacute. So because you know what is an acute condition, there would be erythema, there would be vesicles, there would be redness and all those things. And in subacute, there would be disformation and a little pigmentation would be seen. All right. So normally it affects the dorsa of the finger. So here on this part, on the hands and feet. So this is one part where you can see easily those small nummular eczema. All right. And the factors are, of course, both endogenous and exogenous factors are responsible. Soap, detergents may be responsible for this. So the only, and another thing, eczemas are not, they cannot spread from one person to another. Okay. Unlike ringworm, which can spread from one person to another. Now, the other one is dysherotrotic dermatitis, or also known as Pompholyx. Pompholyx is characterized by small blisters on the hands and feet. And because this word comes from dyshydrotic, comes from is a very Latin word which means bad sweat. But earlier people used to think that because of the bad sweating on the feet and the hands, that's why it is responsible for these type of dermatitis, but that is not the case. It is not because of that. This is again seen to be because of some allergen. Sometimes it is seasonal changes, and emotional or stress factors are seen to be the cause for this. There is a seasonal variation, meaning that normally this type of problems are seen in winters or in a little cold conditions. This symptoms are seen more, or this kind of conditions are seen more. And the sudden is the onset is always sudden. There are clear vesicles with scales, so would be seen. Fissures and lichenifications are also very commonly seen in this condition. So these are mostly seen on the hands and the feet. Small blister like, so you can see the figure here, small blisters like things would be seen. Mostly seasonal affections are there. Emotional factors or stress would be the reason for this dermatitis. All right, and the last one is venous eczema. So this is because of the venous incompetence. It's a chronic eczema normally seen in the lower extremities. There would be increased itching. These are always associated with venous congestion. So these people will also be suffering from varicose veins, which is very commonly seen. And the most common area which would be affected by this venous eczema is the ankle area. All right, and most of the time it is also seen in people who are diabetic, because diabetic patients have this congestion, they have this edema on the lower aspect, they are more prone to secondary infections, so they could be complicated with venous eczema as well. Okay, now coming to the part of homeopathy. So here we'll start with organon of medicine, and then we'll go to the therapeutics. Now, understanding why and how to treat dermatitis. So for this, we have to take the clue from, of course, our master, Dr. Hahnemann. What he said in organon of medicine becomes the Bible for us to follow. Now, what he states in aphorism number 82 is that no real cure can take place without a strict particular treatment, individualization of a case of disease. So, of course, for any disease condition, no matter what terminology we use, whether we are calling it dermatitis, dermatosis, cancer, amyloidosis, whatever name we give to the condition has to be always treated by strictly following the rules of individualization. So individualization of a case is very much important to understand the disease, because we as a homeopath are not only trying to understand the disease condition, but the person who is sick, who needs cure. So that, as it is a holistic approach, so naturally individualization of a case is important. Now, in aphorism number 171, it is stated that Dr. Hahnemann states that in non-venereal chronic diseases, so non-venereal chronic diseases meaning the diseases of the skin disorders are basically caused by miasm sora. So that is what Dr. Hahnemann has said, that skin affections are mostly associated with the non-venereal miasm, and any chronic disease is which is related, which is non-venereal, is basically from sora. So we often, in that case, in order to get a cure, we need to give several antisoric remedies in succession, and every succession being homeopathically chosen in consonance with the group of symptoms remaining after the expiry of the action of the previous remedy. Which means that when a person comes to us, first we do the individualization of the case, and after that, when we come to the conclusion of the remedy, after the selection of the remedy, we have to give the remedy with the potency, and after giving the remedy, we need to wait and watch for the body's reaction, how the body is reacting, how the medicine is reacting on the person. And once that expires, the action of the remedy expires, and all these medicines need to be antisoric remedies. This is what Dr. Hahnemann has said. So these are to be antisoric remedies. And once we know, we have come to the understanding that now after this there is a status quo, like after this we are not able to go further, and we have a status quo has appeared right now. So no improvement, no further improvement, and after successively giving dosage of the same remedy in successive dilutions, like 201 m, 30, 201 m, and after that we did not get any results. So now, after the action of that previous remedy has expired, now we need to go for a medicine which could be given successively, meaning there has to be a complementary relationship between the medicine, and we could give the medicine. So after that, we can give the next antisoric remedy, which could be given, and the treatment should be the aim of that treatment should be not only to give the patient relief from the hypersensitivity of the skin, but also to reduce its lesion, but to give a lasting cure from inside without remission and chronicity or internalization of the disease. Now, this is very important for any homeopath to remember, that whatever cure we are giving with the medicines, it should be from inside out. So we need to understand the Hering's law of cure. So once we have given the medicine, after the medicine has been given, what you need to observe in the disease condition now, after giving medicine, is that the cure should take place from inside out. So it should be that the first symptoms which appear should be the last symptom to go, and the recent symptom which has appeared should be the first symptom to go. So that is how the disease should go. And we need to make sure that again the repetition or the chronicity of the disease is stopped. That's what our medicine should be, or our medicine should be aimed for. Now, what is to be kept in mind while prescribing? So while prescribing, what we need to keep in mind? So, when you take the symptoms, and this is a little jest I'm giving, just a little tips. Every person has their own way. Once in the art of prescription, you learn while practicing. So once we keep on practicing, we definitely get to learn and develop our own art of prescribing. Of course, there are certain rules, certain protocols we need to follow, but each one of us will develop his or her own way of coming to the correct simillimum. The protocols may be a little same, but there would be a little experience of yours when you do case taking, when you do thorough reading of materia medica, and use organon for that. You will get to understand that prescription is basically an art. It's of course a science plus an art. So this is what I'm just trying to make you understand, that these are the things you can take into consideration, but there could be other ways in which you can also prescribe. But one main protocol should be that we have to individualize the case. And for that individualization, of course, you need to understand the peculiar, uncommon, and characteristic symptom of the disease, which makes the diseased person different from the other diseased person. So for that, you need to understand that keynote symptom is the art. How you take out that keynote symptom from the patient, which will help you to direct to the right medicine, is an art. So in whether it is me, you, or whosoever is practicing, we need to understand the peculiar, uncommon, and the characteristic symptom of that person, of that disease condition, which will help us to prescribe the right medicine. Now, in that, apart from this peculiar, so how to come to that conclusion? So normally what I do, this is my way of looking into anything, is the activity, meaning I see the onset, duration, and phase of the disease, like how the disease is going on. Is it fast? Is it slow? How is the growth of the disease condition? So activity. Then I of course look into the causative factors, because causative factor, as I told you, that helps you to understand and also guide the patient what they should do and what they should not do. If I get a causative factor in a disease condition, especially in contact dermatitis, like you see in contact dermatitis, we read that we need to avoid the allergens, because if the person comes in contact, again they will react. All right, so the sensitivity, of course, with medicine will with homeopathic medicine we might be able to reduce, but till that time we need to make sure that those allergens are avoided. The contact dermatitis, especially in the ones where there's contact is causing a problem, that could be avoided. So causative factors are to a certain extent very important to understand while prescribing. Then thermals, thermals helps you to when there are similar medicines which are coming, so you're not very sure which to prescribe. So many a times thermals comes to your rescue. So if the patient if you see that both two medicines are coming and they are very similar to each other and you're very confused like what to give, so go for the thermals, look for the thermals. So whether the person is hot or chilly, that will help you to select the right medicine. Again, that should not be the only criteria. Let me be very clear here. That should not be the only criteria. This is when you are in a confusion between two similar medicine and you're not able to come to the conclusion, then this might be helpful. And the thirst also helps you, because this is peculiar for every person. And thirst also sometimes help. And this is my way of looking into a disease condition, because this helps me to prescribe in the shortest amount of time. All right. Now, therapeutics. So here we would be starting with I would be only talking about very few medicines, not too many. Let us understand a few medicine, but let's understand them so well that whenever a patient enters in the clinic, we get to understand the condition and we are able to prescribe. So because the ultimate aim of any physician or any student or any homeopath is to see a case understand the materia medica, and when the patient walks in, and if we can just looking at the patient, the symptoms and the little uh, problems, a few clean note symptoms, if we are able to get to the right simillimum, nothing could be better than that. All right, so here we would be starting with, first of all, the king of anti-psora is sulfur. So here it is the greatest general psoric remedy, which is used for almost any type of skin diseases, any kind of skin diseases. But here, one thing we need to understand is that the patient will feel very good to scratch. The scratching, and we love to scratch, although the scratching will lead to bleeding and everything, but the patient will enjoy that. All right. Another thing in sulfur patient, these are the most commonly what we see in our clinics, patient coming from every different direction, especially from different clinics, after taking different medicines from different conventional doctors, they come to us. So when they come to us, they have the disease condition has already
repertory book, webinar.
so the
Mute.
has already the clear picture is not seen in these cases, because these patients who come with problems, they have already gone to different doctors, taking different ointments, medicines, and then they come to us. So what we get is a mixed picture of medicine and the disease condition. So herein sulfur plays a very important role. So when patient comes after having applied many ointments, other medication and all those things, if they have this they are hot patient, they are thirsty, and they have strong desire for sweets, and if their aggravation is from washing and scratching, of course there is this dirty look of the patient as well, which is there. So all this thing, if it is seen in a patient particularly, you can definitely give sulfur. So you can start with sulfur, and make sure that repetition in sulfur is not done much, because what I have seen in my clinical practice, that sulfur is a very tricky medicine which you give. It can sometimes lead to aggravation. So whenever you are using sulfur, make sure you're completely aware of the you understand the susceptibility of the person. So do not repeat too much. Before giving any medications, try to give it in dilution, and make sure that because if the aggravation is too much, sometimes these are homeopathic aggravation only, but if it the patient might get a little scared, all right, because they might have taken many medication, and after we give our medicine, they might come up with their real symptoms and everything after taking sulfur, which obviously happen. I've seen in many cases. So in those cases, you need to make sure that you even consult the patient about this. So guide the patient about all these things. And one thing more in sulfur, which I personally use in my clinical practice, is that I never give sulfur at night. So never give sulfur at night, because I made this one great mistake when I started practicing initially, I think 7-8 years back. So I'd given one of my patient sulfur, and because she was using cetirizine and certain ointments for her intense itching, and she would love scratching herself out. The whole night she will keep on scratching. And she was a sulfur patient, so I gave her sulfur, and unfortunately she had this aggravation the other day, and she was itching a lot, and I gave it at night. So from there on, I made sure that I never give the medicine at night. I never give sulfur at night. So don't give sulfur at night, give it in the morning, especially when you're starting the treatment for the first time. All right. So this is how the sulfur patient normally, their lesion will look like red, itchy, and they would love to scratch themselves out and bleed themselves out. Now, Psorinum. So this is another remedy which is normally given to patient, and there is always a family history also. Psorinum is again an anti-psoric remedy which is being used. Here, the patient will have this intolerable itching. So the itching would be very much chronic disease condition where there is a chronicity, involved. Psorinum could be the first choice of your remedy, but here the patient would be chilly. Remember this, the patient is chilly, unlike in sulfur where the patient was hot. Here the patient is chilly and there's aggravation from the winters and cold weather. And in Psorinum, the patient would be suffering from skin disease from the beginning. So throughout the season, it is not like in only in winters they will have, they might have it in the winters as well, but these are the patient normally, how will you differentiate is that these are the people who will have skin problem throughout the year, more or less. And in the winters, it will aggravate. So this is one thing you need to keep in mind. There will be this intolerable itching. Itching is very much prominent, and there's offensive discharge. So the discharges are very offensive in Psorinum. So if there is some oozing or anything coming out of the skin, it would be very, very offensive. And I've seen patients with such offensive discharges. And in one case, I remember when I was giving medicine to the patient, I was actually giving arsenic alb. So after giving arsenic, the patient was getting improved, and then there was this status quo, and the patient was not showing any more improvement after that. So I was very confused what to give later on. So one thing which came to my mind was I had to give an anti-psoriatic medicine. So there was this confusion between sulfur and Psorinum. And because the patient was chilly, I went for Psorinum. And the moment I gave the patient Psorinum 1 mg, miraculously, everything had gone. So within, I think, 15 days, the patient was fine. And she had this, cracks on her hands and on her feet. There was this deep cracks. And for the last 13 years, the patient was showing different doctors with not much result. But with Psorinum, we were able to. But there was, yes, from the scratches, there were also discharge also. The patient was having discharge, a very offensive discharge. So that was one of the reasons why I had prescribed Psorinum. So one was this offensiveness. The second was aggravation. There was this winter aggravation. The patient was chilly, of course. And there was this history of even skin problem, not skin problem basically, but there was this history of asthma. The mother had asthma. So that was one of the point which I taken into consideration, and I prescribed Psorinum on that basis. So this is how normally, because it's a chronic affection. So I've just shown you an example with a photograph. Doesn't mean that only in these conditions you could give Psorinum. There are in many different conditions of the skin inflammation, dermatitis, you can give. So this is one example, because there is like a lichenification, there's instant itching and everything. So Psorinum could be given in such cases. Now arsenic alb. So this is this is one of the, again, very useful remedy which is being used. Here the eczema would be always, there would be itching and burning and restlessness. Mentally, the patient would be very restless. Whenever you are prescribing arsenic, you will see that these patients are very anxious type of patient. There's one very common thing which is seen in arsenic patient. These people are not very hopeful about their future. So they always have this apprehension about what is going to happen in the future. And also when it comes to disease condition, they do have negative thoughts about the disease condition. So the problem is that they do not think that they can get cured. This is very commonly seen, because I remember in one case when we were giving the patient Graphites, thinking that Graphites would work, and it was not working. And finally, we gave arsenic alb. Why? Because the only reason for giving arsenic alb was this patient, one day when the patient came in, the patient was talking, and till that point, she had not talked about this. But she said on that particular day, I don't think this disease is curable. So there was this, apprehension that she would never get cured. It's an incurable. So she had used this word that I think this disease will never get cured because this is incurable. So that one point made us prescribe her arsenic alb. Now, because this was more of an emotional thing and mental aspect which we had taken into consideration, so the patient was given the medicine in 1 m potency, and above that 10 m, and first 1 m, and then we went to 10 m and all. So these are very few things which helps you. Sometimes the mental aspect of the patient helps you a lot to understand a case better. But apart from that, if you don't have much time to understand the mentals of a patient, you can definitely look into certain things, like if the patient is chilly, if there is burning and restlessness, the patient is also having this aggravation from cold from cold application, the patient has aggravation, but on applying hot applications, the patient feels better and always wants to drink something warm. And there's also this thirst for, small sip of water frequently. So if you see all these things, only few things you have to remember. The patient needs to be a little chilly, and with that, if there are eruptions on the skin. Now, one very important symptoms which you have to remember in arsenic album is the scaling of a bran-like. Bran means oatmeal. If you have seen oats, so suppose you sprinkle the oats on the skin, how would it look? This is how the arsenic album skin normally looks like if they are suffering from dermatitis. So this could be also one of your way of prescribing to the patient. So how will it look? I'll show you. Bran-like means oat-like, as if the oat flakes. If you've seen the oat flakes, if it's on the skin, how will it look? So if you see such this skin lesion, you can give arsenic album. So this is how it will look. So this is the bran-like, oats-like. So if you see something like this, herein we can give arsenic album to the patient. Of course, individualization of the case is very important, but sometimes just looking at the case can also helps you to, indicate the medication. Indication could be seen after seeing a case, by seeing a case thoroughly. So this is one way. Now coming to the very important drug which we all know is Graphitis. Graphitis, as we all know, the very keynote symptom of Graphitis is honey-like secretion, sticky secretion. So the color would be a little yellowish color of the secretion, which would be very sticky and moist. So whenever we are using Graphitis, we are using Graphitis for people who are have this tendency to put on weight easily. So there would be always a tendency of these Graphitis patients to put on weight, and the eczematous spots will be normally moist. If there are cracks, it could be also used for cracks and all, for fissures on the skin. But normally when we prescribe Graphitis, we normally look for the eczemas, which is between the toes and the fingers, and weeping eczema. So wet eczema, if you see wet eczema, especially between the fingers and the toes, and if the patient turns out to be chilly, you can give. And another thing is that Graphitis could be given is when there are eczema around the earlobes. So there we can give Graphitis. It works wonderfully good. If Graphitis doesn't work, the second medicine which you can give is Kali Sulf. And if that doesn't work, you can then go for Psorinum. So this is something which I have learned from one of my mentors who told me, and this I have seen that it really works, that when there is Graphitis, when we are prescribing someone, that if you have taken the individualization of the case and for you Graphitis is coming, so for the patient it is being indicated, and especially if there is earlobes eczema with sticky discharge, we can go for Graphitis. If the Graphitis doesn't work well after a certain period of time, probably you can go for Kali Sulf. If that doesn't work, Psorinum will definitely work. So this is one thing I like to share about, which I had learned from my mentors. So this is what you can use in your clinical practice here. But remember that the Graphitis patients are chilly, all right, and they have an aversion to sweets and warm drinks. This is very thing which you have to remember. They have an aversion to sweets and they don't like warm drinks, and of course there is also aversion to meat, which you will find in Graphitis. Okay, yeah. Now, so Graphitis, you can see there is honey-like discharge, where you can see in the diagram here. So weeping eczema or wet eczema are the ones which are in which Graphitis could be given. And then Rhus strokes. In Rhus strokes, normally I've seen that Rhus strokes give wonderful results when it is contact dermatitis. Like I have seen it so many times, and especially in also type 4 dermatitis. Like I told you, I told you about a case where a girl had come to me and she had this eruption, and she said that probably 4 days back she had started using a moisturizer. So in those cases where there is some, because of certain contact with certain chemicals or certain metal or something like that, which leads to some vesicular eruption. Now, one thing you have to remember here, with the contact, there could be vesicular eruptions. It should be itching, burning sensation should be there. The patient should be chilly. There should be some desire for milky drinks. Not necessary that in all the case you will get everything, but a few things if they are matching. And aggravation, if those type of aggravation are normally in some wet, rainy condition, then definitely go for Rustrox. Rustrox is a very good remedy when there are any type of skin eruption, especially acute type of skin infection eruptions from when you go to I have seen results also in cases where the patient had gone to this water park, and after going to the water park, it was in summer season, but they had went to water park, they had been drenched into the water for a long period of time. They came back with small vesicular eruptions on the thighs and the legs. So therein, Rustrox gives very good results. So you can use, there is itching also there, swelling, then there's burning sensation with small vesicular eruption. But if that it is aggravated due to wet or from cold, rainy weather, then definitely go for Rustrox in there. Amelioration in Rustrox would be also from warmth. In a warm, dry weather, normally these people would be better. If there is a chronic skin condition, then Rustrox would be indicated, wherein a disease condition is aggravated, the skin condition is aggravated in the wet, rainy season, but it is better in the warm, dry weather. So this is how this is peculiar of Rustrox. So I've seen many a times just this, small vesicular eruptions which are acute in nature had been because of some application of certain ointments or certain chemicals or detergents or soap, Rustrox, or probably getting wet in rain. Many times people after getting wet in rain also develop such type of vesicular eruption on the body, and there is itching and everything. You can give Rustrox. Now petroleum. Petroleum is in this particular season, the winters, this is where we would be using petroleum, Psorinum, these medicines. Now, petroleum is basically indicated in all the dermatitis which are seasonal in character. So these dermatitis, they are seasonal. So whenever the winters are there, the person will come to you saying that during winters, I have this cracks, this the small, the crack starts bleeding, especially on the palms and the feet. So therein, petroleum comes in handy. Seasonal variation, one thing you should remember, what will help you to differentiate between Psorinum and petroleum is that in Psorinum, like I told you, the patient will have the skin problem throughout the year, and if not throughout the year, there would be some problem associated with allergic reaction. There would be something associated, some allergic reaction like rhinitis or asthma, some family history, all those things. In petroleum, when you give, normally remember that in these cases, there's disappearance of the disease condition. So in the summers, there won't be any problem. In other dry condition, no problem. The moment the winter sets in, the patient will start having the issue. So this is where you need to understand. This is how you will be able to differentiate between petroleum and Psorinum. And one thing more, in petroleum, there are from eating cabbage. In winters, we get this cabbage, cauliflower, all these things. So cabbage, when they eat cabbage, that causes aggravation. So again, petroleum is indicated. All right. So this is how, and this is a classical presentation. These days, in winters, many patients will come to you. You can definitely go for petroleum if it is seasonal. If it is not seasonal throughout the year, there are certain conditions, but it is getting aggravated during winters, then go for Psorinum. If it is only coming in the winters and rest of the year, the patient is perfectly fine, go for petroleum. Now, the last drug here we would be doing is Mezereum. Now, Mezereum is that there would be this intolerable itching, and normally Mezereum is indicated in patient who have eczema on the hairy parts. So suppose in the axilla, on the groin region, or on the hair, if there are eczema, especially, like I said, in the hairy parts, so you can go for Mezereum. In Mezereum, one thing you need to remember that it is from vaccination. So the positive factor is after vaccination, the patient had developed this skin eruption and skin issues. So again, Mezereum could be indicated. So do both this thing. But remember one thing, as in Graphites, we see there is discharge coming out. In Mezereum also there is discharge which comes out. But In Mezereum, there would be this golden pus. It is a little brighter, shiny. This is from the practical aspect I'm telling you. This when you start prescribing and seeing patient in the clinic, many a times you will be confused between Graphites and Mezereum at times, not every time. So here in Mezereum, you should remember that there would be thick crust, and below the crust there would be this pus, like yellowish, golden yellowish pus, which would be seen in Mezereum, and then you give Mezereum. If there is honey like secretion just coming out with crust formation, then go for Graphites. But if there's a thick exudation, very thick, pus-like thing, which and over there is a thick crust, and below is the pus-like yellowish thick exudation like thing, then go for Mezereum. And Mezereum, there would be also, it would be always on the hairy, normally on the hairy parts, and the hairs are glued, matted. There could be also vermins in the hair. So then you can definitely go for Mezereum. It is of course given to the chilly patient, and thirsty is there. And another important aspect is that vaccination. If after vaccination the patient is having this type of skin affection where there is discharge, copious secretion, serous exudation, and discharge from the skin, and thick crust is there, go for Mezereum. So this is how the skin affection would be. So if this type of thick, you can see here how there are thick crust here on the scalp. So this here you can, and in any kind of condition which is on the hairy parts, you can prescribe Mezereum. Now, single remedy from Murphy repertory. So this is for all of you to just remember it. So, and probably if you know, then you can just write down in the chat box. So this would be fun. So if you know, like right now we read about eczema after vaccination. Kindly write down in the chat box. I think all of you know this. Eczema after vaccination, what remedy would you give? Right now we did. What is the name of the remedy? Yes, exactly. It is Mezereum. Very good. If you have written Mezereum, you are perfectly right. Now, eczema with urinary gastric hepatic disorder. I have not taught you this, but probably you will have an idea. If there are any skin affection related with gastric disorder, what is the remedy? I think all of you know this. You should be knowing about this. If you have, and I'll give you a clue, it starts from letter L. It's Lycopodium. So if you're written Lycopodium, you're perfectly right. Now, eczema, which is aggravated at menstrual period and menopause. Again, I have not taught you this, but let's see how your materia medica is. This is for you to remember, very single remedy from Murphy's repertory. So, if you don't have time, if you just know the causative factor, like I told you, causative factor is very important. So probably you can tell me what is the eczema aggravated at menstrual period and menopause. So if you know, you can just write it down. What could be the answer? Let's see. Okay. It's magnesium aceticum. All right. So if you knew the answer, good. If you did not knew the answer, fair enough. You can learn it right now. All right. Now this I want everyone to give the right answer, because I think everyone knows about this. Eczema at seashore from ocean voyage and excess of salt consumption. Now don't tell me you don't know about this drug. This everyone should be knowing. Excessive salt consumption, I think this will give you an idea what it is. Eczema at seashore from ocean voyage and excessive consumption, what it is, I think everyone knows. Yes, Natramur, perfectly right. If you have written Natramur. Eczema without itching, let's see what you have an answer for this. Eczema without itching, what do you think would be the, if you know your materia medica well, you would be able to answer that. Eczema without itching, anybody who knows the answer can write it down. And let's see if your answer is right. It is cicuta. So without itch, eczema, go for cicuta. After vaccination, go for Mezereum. Skin symptom with gastric disorder, GIT disorder, go for Lycopodium. Eczema is seashore from ocean voyage and excess of salt consumption, go for Natramur. Eczema without itching, go for cicuta. Eczema of whole body, let's see what is it. Rhus. So this is according to Murphy repertory. Few things for you to remember, recall. If you had you don't. These are just a few drugs just for you to remember. So when the session is over, at least you know something after from this session. So I think you enjoyed this session with all the single remedies. So remember this. You can give it. If you don't know anything else, if you don't understand anything else, just remember a few of the remedies and few of the symptoms that will help you to prescribe at least. All right. Okay, and now coming to the last part of it, a small case study. And I think if you understand the case, I hope every one of us here today will be able to write the answer, and every one of us will give the same answer. It is said that the homeopaths don't agree, but I'm telling you this time we will all agree to the same remedy. All right. So the case study is of a girl who is 23 years old. I've not written that what her qualifications is. She is a professional working in an MNC, quite intelligent girl. So she had developed cracks in the palms and fingers since last 2 years. The crack appears only in the winter season. It would bleed with no itch. The cracks, especially on the joint of the finger, dry, scaly, better by application of moisturizer. Started only in winters, again this year. The disease appears in winters of every year and disappears once the winters go. And this has been since last 2 years. So this is the case of a girl who is 23 years old, having cracks and dermatitis on the palms and the fingers, cracks and fissures on the fingers, especially on the joints. There are bleeding because of this cracks, and there's no itch, but it appears only in the winters, disappears, and then again it is there and better from moisturizer. Now, what is the appetite? The appetite is normal, but can't eat more after a little mouthful. So after eating a little, feels satiety. Thirst is intense. Thirst for water is there. Craving for spicy food. Stool once a day, satisfactory. Urine 6 to 8 times a day. There is sweat in the axilla and has foul odor. Sleep is sound sleep. Thermal chilly. Aggravation in the winters. Family history. Mother is allergic. Asthma. Father no major ailments. Paternal grandmother had dermatitis and died due to old age. Paternal grandfather died due to stroke. Maternal grandmother died due to old age, and grandfather due to stroke. So this is the family history. This is a small history of the patient. Now the first question to all of you, what do you think is the, so you have to all write down the answer here. All right. So the first question to all of you, before the medicine, first of all, tell me, what do you think is the etiology of the case? What is the etiology? Is it an exogenous cause, endogenous cause, or a combined cause? What do you see here? What do you see? It is an exogenous, endogenous, or something from a combined source? What do you think? Can you please write down what do you think? Exogenous or endogenous cause? Okay, winter exogenous, someone wrote combined. All right. Okay. All right. Yes. So I'll go with the answer combined. Why? Because here the patient is having both. The family history is also there. If you see, the mother had suffered from, yeah, exactly. And winter. Winter is the atmospheric thing. So seasonal thing. So both the things. Very good. So whosoever wrote combined is right. And whosoever wrote exogenous, not wrong, but partially right. All right. Okay. Okay, now the next question, what is the diagnosis? What do you think is the diagnosis of the case? I mean, we taught, I had written about the different types of dermatitis. So out of all the atopic, contact dermatitis, Pompholyx, Nummular, Seborrheic, what do you think? Which type of dermatitis it is? Be perfectly sure. It's on the fingers. Seasonal. Does it click? I'm giving you a hint. Ectopic is chronic. This is not chronic. It is coming every year. There is relapse, of course, chronic that way. But not ectopic is like it is chronic inflammatory condition, right? But here I'm talking about a condition on the palms and the fingers. So there was one classification. What was it? Ectopic? Well, is it contact? No contact. Ectopic? No, I don't think so. Then Seborrheic? No, it happens in the scalp. And it's not nummular. They are coin-shaped. It is not coin-shaped. Then we have Pompholyx and Venous. So we have two classifications. So what do you think? It is Pompholyx or is it a venous eczema? What it is? Let's see. And the answer for the medicine. And the last thing is, what is the medicine which you will prescribe in this case? What is the medicine? Please kindly write down. What is the medicine that you will give to the patient? Okay. All right. So yeah, I think all of us are coming to the same conclusion here. Totality of symptom: eczema, dry cracked fingers, bleeding from the cracks, aggravation in winter, symptoms appears and goes, satiety from mouthful, chilly thermals. So we have the diagnosis is Pompholyx dermatitis, Petroleum 200, 1 dose, and the second dose repeated after 1 week. So you can see the difference in the presentation of the case. And of course, now the patient is completely fine, no issue. So this is what is the remedy. I think most of you gave the said the same thing, Petroleum. Psorinum, why I did not choose here Psorinum is because, of course, the patient is chilly. But as I told you, here there is disappearance of the symptoms. Completely the symptoms disappear or only comes in the winters. So definitely we will go for Petroleum. If it was throughout the year and only getting aggravated in the winters, we would have preferred Psorinum. If there is a status quo after this, then probably in order to, because it is an anti-miasmatic medicine, maybe I will go for Psorinum in the subsequent prescription, because as an anti-miasmatic, if there is a status quo after this condition, like in the second week, you can see if there is no more improvement, then probably we can go for Psorinum. But as of now, Petroleum. So with this, thank you. It was an honor to be with you all today, and happy weekend. Thank you for giving me the time, the pleasure, and the honor to be with all of you today and learn and have a little fun with you all. Thank you so much.
Thank you, ma'am. It was really a wonderful session. You explained regarding anatomy, therapeutics, and even the repertory, which was really refreshing and recalling for everyone.
Yeah, yeah.
And I
Just a moment. Whether
Okay,
she cleared every
Yeah,
doubts, can we have?
we have to take some doubts.
Yeah. Anu, yeah.
Yes. Yes, dear doctors, if you have any doubts, you can type your doubts in the chat box.
Okay. I think there's a question about potency selection. See, whenever we are talking, yeah. So can I answer this question? Is it fine? About
Yes,
the
ma'am.
potency?
Yes, ma'am.
Yeah.
Yes.
So when we talk about potency, see, always go for the potency, go with the susceptibility of the person. All right. If the susceptibility of the person is low, go for the lower potency. If the susceptibility is high, go for higher potency. Now, the question arises how to know the susceptibility of a person, right? This is a very frequently asked question, like how to, ma'am, understand the susceptibility of the person. Yeah, this is one question which might be haunting for all of you. So how I do is, like, when a patient comes to me and when the patient is narrating the symptoms, if the person is only focusing on the symptoms, that this is what I have, this is the issue, and even if I try to inquire, the patient does not go deep into it, into the factors, in that case probably I'll go for lower potency. And I also sometimes I also see the phase of the disease, when you are seeing the, and if you're going for lower potency, remember when it is skin, sometimes when you give lower potency, there could be aggravation. And also if you are giving the right medicine to the right person, there could be homeopathic aggravation as well. So to be on a safer side, do not repeat more, first of all, whatever medicine you are giving for skin affection, because aggravations at times could be very much bothersome for the patient, even if it's a homeopathic aggravation, though we know it lasts for very less time, and once we ask the patient to not take any medication, the patient would feel better. Yet for that moment of time, it becomes a little intolerable for the patient. So all right, so always go for whenever you're selecting, after selection of the medicine, do not repeat it much. This is what I have I understand in my case, that in patients I do not repeat my medicine too much. I always keep I make sure that, you know, after seeing how the patient, and after the first prescription, what I generally do in my case taking, after taking the case and after, you know, deciding on the potency, and for the potency, like I told you, I understand the susceptibility of the person, like how the patient is presenting, the seat of the disease. So, you know, the more intense itching and everything is there, so the itching is more of a sensation. So if the sensation is more, I go for higher potency and the repetitions are less. All right. And in that also, what I do, I give them in water. I ask them to take, whether if I'm giving, like suppose in case of petroleum, if I'm giving 200, then I ask the patient to take it in water. I ask them to take a cup, add to it the globules, and then take the medicine. And the repetitions are always less. I do not believe in repeating too much. I don't do that. So I give very less repetition, and always once I am sure that the status quo has arrived, only then I give the second dose, or else I wait. I keep the patient on SL for that moment of time, especially in skin problems. And I also do another thing. I ask the patient to stop taking cetirizine, because many of the time these people are on cetirizine and on those local application. So I ask them not to take even cetirizine or local applications, not to apply those things. Instead of local application, I tell them to apply, you know, coconut oil. They can and you can make your own ointments also with the calendula ointment. You can give them in the petroleum jelly. You can prepare those and give it to the patient. It is much better than, you know, applying those moisturizers or ointments which are found in the market.
Okay, thank you so much, ma'am. I think it's a combined answer of many questions, ma'am. We have some doubts from the YouTube also. Ma'am, any specific remedy for infantile dermatitis?
Infantile dermatitis for the kids, children.
Yes, ma'am.
All right.
Yes.
So because see, in one thing I have to be very specific here. We cannot give specific remedy for specific disease condition. All right. Because we need to know a certain history of the patient, a certain understanding of the patient's susceptibility and everything. So I will not recommend such kind of prescription. But when it comes to infantile eczema, there are few remedies like Mezereum, because if you see in today's era, immediately once the baby is born, we give vaccinations are started. So one of the bad effects for vaccination could be also a reason for having dermatitis. So, and sometimes dermatitis could be from napkin or rash. Napkin rashes are also the cause for dermatitis. So depending on the causative factor, you can determine, you can go for Rhus, you can go for Mezereum. Psorinum is also useful. Sulfur also acts very well. But for infantile, normally sulfur, Mezereum, depending on the type of the secretion. If there is a lot of secretion, thick secretion, and all those things coming out, go for Mezereum. If itching and too much of redness and inflammation is there, go for sulfur. And Psorinum is also. But then again, you know, you need to individualize the case.
Okay, ma'am.
This is a
question from the. Yes, ma'am. One more
someone
question
has
from
asked.
the YouTube.
Yeah, please.
Ma'am, what do you think about mother's tincture used in the cases of like skin cases or that dermatitis cases?
Yeah. Regarding, you know, mother tinctures, basically, if you go from organon point of view, in any skin affection, we should not be using any type of local application. This is what Dr. Hahnemann has advised for. But of course, we need in skin dermatitis, there is one thing which we have to make sure of, that the skin becomes very dry. And when the skin is dry, it will lead to more itching. So we need to make sure that the person is not having dryness of the skin. So for that, you can give, for if you want to use mother tincture, then go for, the best would be calendula. Now, why I emphasize on calendula is because calendula has this natural property of healing property it has. So it helps in the rejuvenation of healthy dermis. So what if you want to apply or recommend a patient, you can use a petroleum jelly, and in that you can add a mother tincture and give it to the patient. They can apply that. And another thing, to keep the skin dry, glycerins could be also given, because glycerins are bland. You can give it to them and make them apply those. I personally don't use any, I don't recommend, I don't use any type of local application. And the reason being, because many a times I have seen that there are certain patients who are idiosyncratic, meaning they are very susceptible to certain allergens. And sometimes they also give reaction to the liniments which are used in the preparation of ointments, that I have seen. So I make the ointment at my clinic in petroleum jelly, add calendula mother tincture, and only then give it to the patient. I do not recommend using any other product. I mean, I am sure what I am using and what I am giving, so that's what I prefer. But then again, it depends upon person's individual choice also. But as far as homeopathy is concerned, if it is better to treat the patient internally, so go for internal medication. But as a supportive for the skin to have better moisturizer and better growth, probably you can go for calendula ointment by preparing it in petroleum jelly and can give it to the patient. All right.
Okay, ma'am. We have another question from the chat box, that please suggest a remedy for melasma. It's aggravation from the sunlight.
If there's a melasma from aggravation from sun, see, Natramune is a very wonderful remedy which you can give. Apart from that, because we're talking about this application here in melasma, Artica urens as mother tincture, you can ask the patient to apply. This will help. This helps. All right. So in that case, you can give aggravation from the cell melasma. And if it is a woman, a woman who is suffering from melasma in her menopausal age, you can go for sepia. Again, why I'm telling you this, melasma is also related to the hormonal changes, especially in women it is. So Natramune and sepia, both of them has this hormonal changes. They are good medicine to be given in any hormonal condition. So that's why you can go for Natramune or sepia. But then again, take the case taking, please.
Okay, ma'am. And again, the remedy for white patches on the body.
White patches?
On body.
Okay, white patches. See, one medicine which you can give without much thought is Ars iod 30. You can give it to patient. I've seen good results. Ars iod 30. Even if you don't have a proper case, and somebody has just asked you, it will stop. At least it will stop the white patches. And many a times the discoloration starts to go. But again, as I told you, casing is very important. But if you're asking from my personal experience, then Ars iod I have seen working very good in removing the white patches.
Okay, ma'am. We have another thought that Psorinum aggravate in winter. So, ma'am, what should we do?
I didn't get the question.
Ma'am, the participant is asking that Psorinum aggravate in winter. So, what should they do for that?
Psoriasis, or are you talking about Psorinum?
Psorinum, they are asking about the medicine. This
Psorinum.
they
That
are
in Psorinum, the winter aggravations is there.
yeah,
Okay.
yeah.
So should we give or should we not give? Is it the question?
Yes, ma'am.
Okay. So winter aggravation, Psorinum, when you are giving, like I told you, you need to be very much sure about the susceptibility of the patient. Skin, as you know, is a very sensitive organ. So if you are giving any remedy, I have seen getting, it on the skin rashes. I've seen patient, the moment they are, I tell you, recently I had a case where the patient was having this psoriasis on the skin, and the patient was on allopathic remedies for 2-3 years, and we had prescribed to the patient Psorinum 1M. At night the patient took this dose, and the next morning there was this whole lot of aggravation on the body, and that is going to be there. This is completely understood why it happens, because the patient is applying ointments and everything, so there is going to be suppression. The moment you give the right remedy, and if the potency is the right potency, there would be a little aggravation of the case. But the moment there is aggravation, the patient gets scared and they don't take the medicine then on it. So in those cases, go for, like, suppose you are scared that if we give Psorinum 1M or 200 and winter aggravation, if it aggravates, then what? Go for 50 millisievert scale. Then you will not have those aggravation. If you are very sure about the remedy, that Psorinum is the only remedy which is to be given in this case, and this could lead to some kind of aggravation, or there could be a problem from the patient side or to the patient, then go for 50 millisievert scale. Then the aggravations are not there at all. Even if it's there, it's very minute, and it doesn't cause much of a problem to the patient. 50 millisievert is better in that case.
Okay, ma'am. So I think the last question, dermatitis due to chocolate intake and dermatitis occurred especially around the joints and lips.
If it is around the joints, you can go for Graphites. It is a very good remedy. If it's around the joints, even Rustox could be given. If it is around the lips here, I have normally, if it is around the lip, if it is because of some application of lipstick or something like that, some chemical, then Bovesta is a very good remedy. But if it is because it is just around the lips, you can go for Natromur as well.
Okay, ma'am. I think we have covered all the questions from the dermatologist, but we have many questions from the except the topic like for the words but I think we are running out of time, and we will take these questions in that particular topic.
We will do it in some other session
Yeah.
next time. We'll definitely suggest.
Yes. So I invite Dr. Kirtana for the official vote of thanks. Please, doctor, give our faculty for official vote of thanks.
Yeah, thank you. Thank
Dr.
you, ma'am. It was really a
Kirtana?
wonderful session. Yeah, can you hear me?
Yes, I can hear you. Yeah.
Yeah. Thank you, ma'am. Really, it was wonderful. You have explained from anatomy and also all the ailments factor and all the therapeutics part and the specific remedy, Murphy repertory and all. It was really very useful, and it was really recalling and refreshing thing for everyone. And I really extend a hearty vote of thanks. And you have spared your time even in your busy schedule to grace the occasion. And today we had great opportunity to hear your experience, and this will surely be going to encourage us in future and also for practicing. Thank you, ma'am. Thank you so much. And thank you everyone who have joined and for subscribing the IHMA YouTube channel. Thank you everyone once again.
Thank you so much. Thanks a lot.
Yes.
Namaste.
Yes. Thank you so much, ma'am. Yes. Good night, everyone.